The treatment of an aging face or aging skin is determined by a number of factors. Most importantly, we must establish right up front what the client wants as an outcome, what they expect to achieve through the treatment, and thereby either satisfy their original concerns or perhaps more than what they originally believed was of a concern to them. Secondly, we need to consider the downtime that a client will be subjected to through the treatment. Some treatments have no downtime, others have a minimal amount of downtime, and as treatments advance, there is an increasing amount of downtime for specific treatments. We also need to consider the costs involved because more superficial treatments may be less expensive, in particular. Another consideration is the issue of cost, and we give clients who specifically want to look at an array of treatments a price quotation that covers a broad spectrum of treatments that can be given for their condition. If they specifically want a particular treatment, then we would be giving a quotation just for that treatment. Finally, in terms of the specific client themselves, and as an aesthetic practitioner, it behoves myself and my colleagues to give a recommendation based on the specific client, their circumstances, as well as their specific concerns. So there are no real cookie cutter treatments that can be offered for all clients, but rather that they be tailor-made to each individual client according to the factors that I have enumerated. Treatments of the aging face cover a broad spectrum of treatments ranging from conservative or superficial treatments to significant or deep treatments. The determination for which treatment is used is a series of factors taking into account the patient's desired outcome, the cost of the treatments and the amount of money that the patient is willing to spend on the treatment, the amount of downtime that the patient is willing to have, and finally the medical practitioner's interaction with the patient to determine what is most beneficial to the patient in this particular instance. In terms of superficial treatments, there are treatments such as botulinum toxin or Botox, there are dermal tissue fillers, there are light chemical peels, and these treatments are combined with others such as carboxytherapy, removal of pigmentation through light therapy, and the supplementation of these treatments with at-home care by the patient vis-a-vis skincare products, and also supplementation with wellness products to aid in regeneration of the skin and also provide the patient with an improved general feeling of wellness. When one looks at slightly deeper treatments, moving away from the superficial treatments and bearing in mind that superficial treatments can be combined with medium treatments, we start to look at more specific laser treatments for the removal of lines, for the improvement of texture, the removal of pigmentation, and general improved appearance of the face. One can use stronger chemical peels for this purpose, but we tend these days to gravitate to the more advanced technique of laser treatments for the aging face when looking at medium level treatments. When looking at the deep laser treatments, we can consider either one-off treatments or a series of treatments to achieve the desired outcome.